Talking with Dr. Joel Wallach today, and you have a book called Dead Doctors Don't Lie. Can you talk about the premise behind that book?
Sure. Thank you, Scott. Well, basically, my background is different. I have a degree in agriculture. I'm a veterinarian. I'm a comparative pathologist, worked for NIH and National Science Foundation, big universities, and I learned that we could prevent and cure as many as 900 different diseases, prevent all birth defects in livestock and laboratory animals and pet animals with simple nutritional supplementation. And I was an abysmal failure at getting medical doctors interested in this concept. So I went back to school and became a naturopathic physician, and what I found out was that the average lifespan of a medical doctor, I said at the original time back in 1993, was 58. And I said, well, why would you go to a group of people whose average lifespan is 58 to learn how to live to be 100 in a healthful way? And they didn't like that, so they did their own study, and they came out with, and they said, well, Wallach lied. The average primary care physician and family practitioner does not live to be 58 like Wallach says. We live to be 56. And so I had to publicly apologize for giving them too many years. And basically my premise is that if doctors knew what they were talking about, they should live to be 125, 150. Mm-hmm. And they've missed the target so badly that only the dead ones don't lie.
Why is that? Why is that their life expectancy is so much shorter than what we would expect?
Well, Scott, the reason is very simple. Remember, I'm a pathologist, so I can dig into their autopsies, right? And so I know exactly what they die from. They die from heart attacks and stroke and diabetes and cancer and kidney failure like everybody else, so they don't have anything that they die from that's different. And the main thing, their main weakness for their own personal health as well as for the health of their patients is that they only get 30 minutes of nutritional training in 14 years of medical school. They do not even get a test on that 30 minutes. So they look at nutrition as something unworthy of their time or interest. Mm-hmm. And as a result, the basic stuff of life escapes them, not only from their training, but also from their consciousness. And they think, well, just eat well, you can get everything you need. And they have no earthly idea how bad our nutritional crisis is. And that's the problem.
We've talked to a number of doctors here this weekend at the Health Freedom
Yes.
Expo, and they have similar stories that you have, that we've been able to do this, and it's been simple because of this and this.
Yes.
What is holding solutions like that back from becoming mainstream therapies?
Okay, well, two reasons, Scott. Number one, there's insurance. And people say, why should I spend $2 a day for a treatment that my doctor poo-poos when I can get the treatment he wants me to do for free from insurance? You know, we want that Canadian free health care. Yeah. And so that mentality in the American public has held it back because the public is not demanding the cure, if you will, just from something simple, but it might cost them a third of the cost of a cup of Starbucks coffee. The second thing is the pharmaceutical industry drives things. You see, there's no law requiring doctors to cure people when there's a cure available. There's no law requiring doctors to prevent diseases in people when the prevention is known. Now, if it were my way, if I were the U.S. Surgeon General, the first thing I would do is pass a law. You see, as this agency, they could make a law. They don't even need to go to Congress and get it approved. They could just make a law. Well, I would make a law by fiat. I would make a law that said that if there's a disease that is curable with anything, whether it's an herb or a drug or a nutrient, if it's curable and the physician just treated the symptoms as opposed to curing it, there was a cure available, I would put them in jail for a Class A felony for 25 years to life. And by the time you did it to the first 1,000 physicians, the rest of them would start recommending the cure, right? Because they wouldn't want to go to jail. But of course, that's not going to happen. The pharmaceutical and the medical lobby is too powerful, so that's not going to happen. So what has to happen is education. For the last 33 years, this is the 33rd year I've been doing this, Scott, giving free lectures, or 300 free lectures each year. 300 free lectures a year, okay, to educate people that they do have options. Well, it's only been in the last 2 years with the financial meltdown and with the medical meltdown that people have begun to say, well, what is this stuff you've been talking about, Wallach? Suddenly now they're interested, because if you lose your job, you don't have insurance. Suddenly now what they perceived of as a free treatment isn't free anymore because they have to pay for it out of their own pocket. So now going to a doctor for a $10,000 knee replacement becomes unconscionable for them when they can fix it with a $2 a day nutritional supplement.
Mm-hmm. You know, it's funny you mentioned under your system maybe put these doctors in jail.
Yes.
Maybe not to that extreme, but the opposite happens where physicians like you or others that we've talked to get, pushed aside, have their licenses taken away, get fired.
Or get fired.
Fired, yeah. I mean, so it's kind of happening in the reverse order right now still, isn't it?
Yes, it's still happening incorrectly because, of course, the pharmaceutical industry and the medical monopoly, it's a monopoly, is in control. They give more money to PAC committees, to legislators, than any other group there is. Okay, and the thing that happens is when you give that much money to legislators, suddenly now these guys are the only guys. Everybody knows that the medical system is the perfect and single worthy system because it's the only system. Now, this was known 290 years ago. The first U.S. Surgeon General, a guy by the name of Benjamin Rush, who was an MD, realized that the different philosophies of medicine were fighting amongst each other. They were actually having gunfights in the street. Certain groups of medical doctors would take over a hospital and lock the doors, and the other groups of medical doctors would march down to the town armory and get a cannon and blow the door off. They go in and have gunfights because one was homeopaths and the other ones used herbs and the other ones liked physical medicine and stuff. They were literally having gunfights over this. And so Benjamin Rush, who was the top surgeon for the Continental Army during the Revolution, George Washington personally appointed him as the first U.S. Surgeon General. There's a very famous story. He said that he wanted an amendment in the Constitution which said that people would have their choices of medical sciences. He said, if we don't have an amendment in the Constitution giving people their choice, free choice of which medical science they want, like their choice of religion and freedom of speech, he said, somewhere along the line, and I'm quoting him now, one class of men will take over the medical sciences and it will be the Bastille of America. Now, his fears have become our nightmare 290 years later because the free enterprise system has never taken place in the medical industry since the American Medical Association was formed. Everything they've done for the last 100 years was not to learn how to treat patients better. Everything they've done for the last 100 years has been designed to kill off all competition and make them the sole source of medical knowledge, the ones, the chosen ones, right? That was their goal, and they've become successful. And so the only way this is going to become undone is if people stop using this failed and corrupt system we know as our medical system. Right now, the average lifespan of Americans makes us 46th in the world in longevity. There's 45 other countries whose peoples live longer than us. We're 92nd in healthfulness. And we spend more money for health care than all the other 218 nations in the world put together. So their system is a failed and it's a corrupt system. And so again, the people are going to have to rise up here and choose to do things themselves, and then the medical system becomes unfunded. If nobody's using it, how can you justify funding them? And so this is how it's going to happen. Because the pharmaceutical industry, the medical industry is so powerful, and they form what I call the unholy trilogy with the government. I'm talking about city, county, state, federal government, and the pharmaceutical industry and the medical system have formed this unholy trilogy. And they, according to the Center for Disease Control and their own journal, the Journal of the American Medical Association, 4.5 years ago, it was February 7th, 2007, they came out and said that these two agencies, the Journal of the American Medical Association and the Center for Disease Control, the federal agency that tracks these things, that medical doctors kill, injure, and infect 15 million of their patients every year in American hospitals and their private offices. 5.8 million in hospitals and 9.2 million in private offices. They kill, injure, and infect 15 million. They don't even get an OSHA ticket. They get a walk. Now, what if cab drivers were to do that? Everybody said, my gosh, I'm going to walk. Well, Roy, it's 50 miles to the airport. I'll just leave 3 days early, but I'm walking. I ain't getting in a cab. But yet people still line up to get this very dangerous, very ineffective. I mean, we rank 46th in the world in longevity and 92nd in healthfulness. The recipe is not a good recipe, Scott.
You learned a lot about nutrition as a veterinarian when you first started. How did that translate into what you're doing now and what you learned back then?
Well, everything we learn about human nutrition is first studied in animal nutrition. And again, we learned how to prevent and cure as many as 900 different diseases in animals, simple with nutritional supplementation rather than stem cells and genetically engineered proteins and organ transplants and wonder drugs. We have triple lifespans. We have triple lifespans. An old dog 60 years ago was 8 years old. Today, an old dog is 25. We did that simply by putting vitamins and minerals in either their canned dog food or their dry dog food. And as a kid, it seemed odd to me that we did that for animals and nobody was doing it for people. And so it was very, very heavily imprinted upon me that you can only be in business financially in the livestock industry, because that's how I grew up on a purebred Angus farm, was that you had to have, when you're feeding 100 cows, you had to have 100 perfect pregnancies without some kind of problem where the cow had to be in bed for 3 months, the last months of pregnancy. You had to have calves that were healthy enough to stand and nurse out in the pasture in the middle of the night when they were born without attendants. And you had to have enough health in those calves so that they reached market weight or reproductive age without the need for veterinary care. We're able to pull that off just simply by adding vitamins and minerals. And as a result, when I looked at the people living on farms and all their early deaths, what they were dying from, I said, well, we got rid of that in animals. Why aren't we doing that for people? And people said, medical doctors and teachers and professors would say, well, you get everything you need in your 4 food groups. Well, of course, that's nonsense. And along about 1978, I actually discovered the cause, prevention, and cure for cystic fibrosis. And at first, every expert in the field of cystic fibrosis, which is a childhood disease thought to be incorrectly, but thought to be a genetically transmitted disease, it turns out that it's a congenital deficiency of the trace mineral selenium. And I proved this, got experts to agree on my cases of cystic fibrosis in primates. I was working at the Yerkes Regional Primate Research Center in Atlanta, Georgia for Emory University and NASA at the time. And I'd been in the orthodox medical field for many, many years. And the book that I had written on some of my projects, one of these big 1,200-page reference books, is in the Smithsonian Institute as a national treasure, right? And they fired me because they said, well, you got to be sniffing glue because everybody knows this is a genetically transmitted disease and you're going off on a tangent. So they fired me. They didn't leave it go at that. I went and I actually got another job at St. Louis University as the director of their laboratory animal facilities, and NIH chased me and said, we'll defund you guys if you hire him. So they fired me again. I wasn't even unpacked, right? So I knew this was going to be a disaster. And so what turned this around nicely was 2 years ago, the National Science Foundation in their official journal came out and said one of the most useful findings, unexpected findings from basic research, where it was just serendipitous finding, was the discovery of cystic fibrosis in a monkey by a young pathologist. Well, they said with a little bracket that Emory University refused to release the name of the young pathologist, me, because they'd fired me, right? So we're in the process of getting the record corrected and so forth. And we've taken this now to muscular dystrophy. We now know the cause, prevention, and cure of muscular dystrophy. We've known it for 60 years in the livestock industry, and of course the medical system, well, they dismiss that, well, that's in animals, not true in people. Well, I spent 2 weeks in a county in which a significant number of kids are born with muscular dystrophy, and we're able to reverse it quite simply with supplementation, and certainly preventable because Purdue University has already done the groundwork in the animals in the area, and because these minerals are missing in the soil, they couldn't raise livestock. So Purdue University found out 50 years ago if you add these minerals to their feed, no muscular dystrophy. But the people living on the land there got muscular dystrophy because they didn't supplement. It's just beautiful. So we've made a complete system, which we call the Mighty 90, and there's like 25 different ways to get that, depending on, people have allergies to shellfish, or they've got allergies to this, that, and the other. So we've come up with 25 different ways to cover every known eventuality, whether they like liquids or capsules or whatever. We've covered all these things in what we call the Mighty 90. We assure them that they're going to get optimal in many cases 8,000 times or 16,000 times or 30,000 times the minimum data requirement. Because when you have a disease which is debilitating you to the point where doctors have got you on pharmaceuticals. They want to cut your knees out and put in artificial knees. People don't want to wait a year to be healed. And so what we've learned is to use a bigger hammer, and I call it, and to give them mega doses of nutrients to the point where we can rebuild joints, we can rebuild the cartilage. I've had people who's got their meniscus has been surgically removed because of terrible accidents. They've all torn up. They've surgically removed these, and we've rebuilt them because surgeons are sloppy. They always leave a couple of stem cells for me, and I can get to them and rebuild the cartilage, rebuild the meniscus. I do this all the time with these raw materials. And so we've learned over 33 years a lot. And so we use a heavy hammer so that within 3 to 6 weeks, people are saying, I can't believe this. I mean, I was on medication for 40 years. I'm off my medication now after 3 weeks. People who are all gnarled up with rheumatoid arthritis, it took a year, but their fingers are all straightened up and they can play the piano now. Okay? People who were scheduled, in fact, very famous people. Andrew Young, who was Jimmy Carter's ambassador to the UN. He was the mayor of Atlanta and the U.S. representative from the state of Georgia. He was scheduled for double knee surgery 20 years ago. And his son called me up and asked me to help him. And I regrew his knees 20 years ago. He canceled his surgeries. And I rebuilt his knees for him. He's never had to rebuild his or have his surgery done on his knees. I'm the guy through Andy Young who rebuilt Evander Holyfield's heart. Now, you think about it. Here's a guy who had a heart attack during a championship fight, was able to go back and get a approval in the Boxing Commission physicals to go back to box professionally after he's had a heart attack. How can you do that? Well, I can do that. I take people off of the dialysis all the time. I get people off the heart transplant list all the time. I regrow cartilage. I grew heart muscle. I grow knees. I regrow kidneys. I make kidneys function. I reverse muscular dystrophy in kids. I reverse cystic fibrosis in kids. And so it's very, very gratifying. Oh, here's another one. Dementias. Big problem now with 80 million baby boomers coming along. They're all going to get dementia because they followed the doctor's advice. Alzheimer's disease is a physician-caused disease, just like vitamin D3 deficiency is a physician-caused disease. Erectile function and menopause are physician-caused diseases. I can tell by your face you're sort of like, what?
Yeah, menopause, I thought that was something that...
Well, menopause, our grandmothers went through menopause in 3 seconds without one hot flash. Now, our modern women spend half their life dealing with it, and they go through 3 husbands because guys can't stand it, right? And so... basically what it is they've been told they got to give up cholesterol, right, in their diets. Well, cholesterol is the raw material for ovaries to make estrogen and progesterone. Cholesterol is the basic raw material to make steroids, which make estrogen and progesterone. So you go on a low cholesterol diet, you get cholesterol-lowering drugs, you're going to have menopausal symptoms to the point where you're like a flaming idiot, right? Men will have erectile dysfunction because testosterone is 95% by weight cholesterol. You want a cholesterol-restricted diet, cholesterol-lowering drugs, there's nobody home anymore, right? It's very little simple. When it comes to Alzheimer's disease, 75% of your brain weight is this fatty insulation material called myelin. And when you get Alzheimer's disease, the myelin goes away and the naked nerve fibers all tangled up, and it's legendary that nerve tangles are the iconic diagnostic feature of Alzheimer's disease. Nerve tangles compared to the other 3 classic dementias, which don't have that. And this myelin, this fatty insulation material of the brain that makes up 75% of your brain weight, is 100% cholesterol. So you're on a cholesterol-restricted diet, you take cholesterol-lowering drugs, there's nobody home up here, nobody home down there. I mean, life is a mess. Doctors, for the last 50 years, have been telling people to stay out of the sun because of skin cancer. Now, if you have to go out in the sun, Scott, be sure you're taking SPF 7 billion, sun blocker to protect yourself. You have to wear long sleeves on top of that, gloves, big brim hats. Do not go out in the moonlight because you're going to get skin cancer. And for gosh sakes, do not take any vitamin A and D because they'll damage your liver. And so everybody in America has a vitamin D3 deficiency. Now they've discovered that vitamin D3 is useful. Oh my gosh, everybody's got a vitamin D3 deficiency. Well, medical doctors cause that by telling everybody to get out of the sun and stay away from vitamin A and D. And so you think about it, all the diseases that doctors have caused now are found in the highest of levels in the baby boomers. Obesity is a physician-caused disease. 40% of Americans are obese. 40% of Americans are obese, Scott, and this is caused by medical doctors' misinformation, misadventure, and criminally negligent advice.
Doctor, another point that you hit is that athletes, on the average, seem to die earlier than your average couch potato.
Yes, our librarian.
Seems odd. Why is that?
Well, it's just the opposite of what you think, and it's because people really don't understand physical physiology. And that is this. With the exception of the 3 black guys from the old Negro Baseball League back in the 1920s, there's never been a professional athlete lived to be 100. Now, that should begin to give you clues, red flag. Now, these guys are getting paid to train and work out. They're getting the best food, the best trainers, personal physicians, team physicians. I mean, they have it all, right? They're being paid to work out, and they get the best. But yet the average lifespan, when you take all sports, is 62. The new statistics out for Canadian professional football players is 51. Reggie Lewis, who was the captain of the Boston Celtics, died at 28 of a cardiomyopathy heart attack, a simple nutritional deficiency. Let's see here. Walter Payton died at 45 waiting for a liver transplant from a simple mineral deficiency disease, which I treat all the time. We can reverse that disease in a few weeks or a few months with a simple supplement, and he died waiting for a liver transplant. And then we just recently had a 16-year-old boy, Wes Leonard, from a little high school in Michigan. There were 2 teams fighting for the last slot in the playoffs to be the state champions. This just happened a couple of months ago. Yep. And Wes Leonard was 16 years old, and the teams, it was 55-55 at the last buzzer, so they had to do a prophetic term, sudden death, playoff, right? So he catches the tip-off, 3 or 4 dribbles down to the basket, slam dunks it in like 3 seconds after the whistle to start the sudden death. He gets the winning 2 points, 57-55. His teammates are lifting him up because they're so excited, and he drops dead of a cardiomyopathy heart attack. The same thing that Reggie Lewis did, 17 years earlier. And see, the medical system hasn't learned anything because we eliminated that disease in children 25 years ago in China. In China, these cardiomyopathy heart disease that these athletes die from is called Keishan disease. It's one province doesn't have the selenium in the soil there. And these kids, like 13 out of 100, are dying from this heart disease when they're little kids. So my wife and I went there in China, and we did 1,200 autopsies on these kids, on kids under the age of 10. And the Chinese government now gives every kid this trace mineral when they come to class. They haven't lost another kid in 25 years, okay? Because the government makes sure, under penalty of severe punishment, if the teacher fails to give those kids that pill every day. Here we have these kids. We've known this in the animal industry for 60 years, Scott. For 60 years, we've known the cause, prevention, and cure for this disease. And yet medical doctors say, well, we give them electrocardiograms before each season. We just need more physicals. That'll do it. Well, no, it won't do it because they know nothing about nutrition. They don't realize that when you sweat, you're not sweating out water. You just drink water, you're going to die. Whether you're a roofer in the summertime, and it's 120 degrees up there on the roof, and you're sweating like a pig, or you unload trucks, or you work in a factory, you're doing physical labor on the road, or you're an athlete. If you're sweating, you're not sweating out water. Sweat is a soup that contains all the nutrients floating around your blood. And if you're replacing that soup with water, what's happening to your nutritional reserves? Replacing the soup with water, your nutritional reserves go down, and when you reach a certain level, below a certain line, you die. There's another 19-year-old girl just died of a copper deficiency. She's 19 years old. Florida State University, died of a ruptured aortic aneurysm, which is caused by only one thing. Well, 2 things. One, you get crushed against a loading dock by a truck, or copper deficiency. We learned about that in Turkey, Scott, in 1947. We eliminated ruptured aortic aneurysms in Turkey in 1947. So she died of something that a turkey wouldn't even die from. Because medical doctors know nothing about nutrition. They all should be put in jail for it.
I like to think that we've learned a lot about nutrition a lot more in the last couple of decades. When you talk about doctors not being up to speed, why is that still the case?
It's still the case. They're about 200 years behind. And, for instance, we get people off the heart transplant list all the time. We get people off of dialysis all the time. We regrow cartilage all the time. And, of course, the medical system says, well, you can't regrow cartilage. You need joint replacement surgery. You can't regrow disc between the vertebrae. When you have back pain and you have peripheral neuropathies and as a result of degenerative disc disease, you must have back surgery. Well, that's not true. Just absolutely not true. We can regrow cartilage. It's very simple. You just give the body the raw materials. The body has stem cells in it. Just like you cut your skin, you don't need a skin transplant. When you cut your skin heals itself because of the innate stem cells that are in our tissues. Well, the same thing is true for cartilage and bone. You fracture your bone, you don't need to put in a pin in your bone. You fracture your bone, you immobilize it with a cast, and it will heal itself. And so the same principle is true for the hearts and the kidneys and so on. For instance, here's a good one. I love this one. When you have kidney failure, there's nothing wrong with your kidney. When you have kidney failure, there's nothing wrong with your kidney. What happens is the little microscopic artery, which is called an afferent artery, that brings the dirty blood into the filtering unit is plugged. Two things happen here. Number one, the kidney can't work. It's kind of like a drain in your bathtub that's got hair and hay leaves and dirt and soap scum on it. It's not going to drain. Do you replace the tub and all the plumbing? No. You take your hand and you scoop off the stuff covering the drain. It drains. Well, I said, well, why can't we do that here? And so we figured out how to open up those little afferent arteries, get the blood flow back to the filtering units called glomeruli. And of course, the kidney is a funny thing. Its whole purpose is to filter blood. And when it doesn't get enough blood, there's kind of a little signal that goes off. A little red flag goes up, and the kidney releases a hormone called renin. And renin's purpose is to raise your blood pressure to try and drive more blood into the kidney. Raise your blood pressure, right? So doctors give drugs, and they can't override that hormone. So well, it's genetic because drugs won't touch it. And so what we've learned how to do in the last 10 years is open up that little microscopic artery. And we've been doing this for 10 years in humans. We've been doing it for probably 50 years in animals. And there was an article today in Nature magazine saying they've discovered this wondrous stuff now that they can actually help a heart in a heart attack by opening up these little microscopic arteries with a protein. I haven't read the article yet, but I'll bet it's the protein we've been working with for 25 years.
Doctor, if we have a condition, we've talked about a number of them, is it safe to assume that it's related to a deficiency, or how do we know exactly?
Well, this is where my wife and I have spent the 25 years of our marriage. We've been married a quarter of a century, and I just love her to pieces. And she's a medical doctor. She actually taught microsurgery at Harvard, at Texas Medical Center, at the University of California. She's internationally known as a microsurgeon, very famous. So she and I have spent the 25 years of our married life not only in love with each other, but also in love with people. And we've written 14 books to teach people how to protect themselves, how to do their own physicals for $3.79. All the numbers in there, how to read the numbers from their medical reports so they can do a better job and not have to depend on a doctor's maybe self-centered advice. The doctor is giving you advice based on his income needs. He's not going to let his house be foreclosed upon, okay? And so instead of using you as an ATM machine, you take care of yourself by reading these books, coming to my free lectures, using our suggestions for the Mighty 90, the 90 essential nutrients, and you can prevent as many as 900 different diseases, with the exception of most birth defects like cleft palate, heart defects. Those are surgical cases. But things like muscular dystrophy and cystic fibrosis, these are biochemical defects which are reversible with supplementation after the baby's born. And so these are things we're teaching people how to do. She and I have spent the 25 years of our marriage running around the world, literally, 58 countries, giving these free lectures. We do interviews like the one we're doing with yourself, and we're very grateful that you're helping us spread this message. And our goal is to devote ourselves as a married couple as well as individuals to train an army of people to take care of themselves, take care of the people they love, take care of their neighbors, and stay away from the medical system as much as they can. Obviously, you get run over by a truck, you got to go to an emergency room. If there's any place that the medical system shines, it's in the emergency room. They can do wondrous things. They can save people from some of the most terrible traumas. It's just amazing. And this comes from our experience in the military, right? This ability to deal with trauma comes from our experience in the military. And so this is where, if any place, the medical system should be used. When it comes to treating diabetes, we can make everybody's town diabetes-free in 2 weeks. We've known how to prevent and cure type 2 diabetes in the animal industry for 60 years. And as I've employed this knowledge in my human patients, we get people off of their medication to go back to normal life in anywhere from 2 to 6 weeks, sometimes as fast as 2 days. Now, when you do this with thousands and thousands and thousands of people every day, Scott, through the internet and through my associates around the world, you cannot say it's a fluke. It was just one person out of about 10 million. No. We're talking about everybody. If you're a type 2 diabetic, we can get you off your medication. If there's any, again, one piece of advice that we give to people is check us out and say, okay, this Wallach sounds pretty crazy, just like they say. He must be sniffing something. If it were true, as you'd say, the mainstream healthcare industry should be all over this. In our heart of hearts, we'd like to believe that they're altruistic and they're out there trying to help people, and they have a nice living, which would be righteous if they were doing good things. But unfortunately, that's not the case. Their primary goal is not to make people healthy. In fact, Harvard Medical School did a study on first-year medical students after they'd been accepted. They did an anonymous survey. Why did you apply for medical school? 85% said because I want the lifestyle and the credibility and the view of the community of, being a wonderful person by being a doctor. By contrast, when they went to nurses who had gotten into nursing school, the first-year nursing students, when they asked them, why did you go into nursing, they say, because we wanted to help people. Okay, and so go to a nurse practitioner, don't go to a medical doctor. Go to a naturopathic physician, don't go to a medical doctor.
Doctor, I want to talk about salt. A lot of people have high blood pressure, so stay away from salt. But we need it.
Well, salt is an essential nutrient. Sodium and chloride. You cannot have nerve impulses without sodium chloride. They're an integral part of the biochemical system of nerve transmission. You cannot move water around in your body or retain it in the right compartments, inside your blood vessels, inside your tissues, inside the cells. You can't keep things in the right compartment without sodium chloride. The chief cells in your stomach cannot make stomach acid without salt. Okay? Salt is the raw material. Sodium chloride is the raw material to make hydrochloric acid in your stomach. Now, two things have happened because of this terrible criminal advice that doctors have given. It's criminal. Anybody else do this to the American people, they'd be put in jail for life. Some of them would be executed because of the number of people who are killed over this. Right? Salt is required to make stomach acid. You don't have enough stomach acid, you get reflux, incorrectly called acid reflux. It's reflux. Mm-hmm. Reflux is caused by insufficient amounts of stomach acid, not too much stomach acid. So doctors have even named it the wrong thing, right? And basically, you get reflux when you don't have enough stomach acid to keep your stomach environment sterile. So yeast begin to grow in there, so you eat carbohydrates and sugar. They ferment that, produce gas. Heartburn, pressure, reflux. Mm-hmm. Because you have all these things growing in your stomach. Okay, when you get a pH too high, you get a pH above 4, all these things begin to grow. You have a pH under 1, your pepsin works to digest proteins, and you can absorb minerals, you can absorb B12. Your pH gets above 2, 2.5, you can't do that. Okay, so you're in trouble. I mean, you can take tons of iron supplementation, and if you don't have any stomach acid, you can't absorb iron. Now, here comes the most terrible thing that's happened to America because of this inappropriate advice. Well, there's two things. One, you go back to 1995, 750 people died during a triple-digit heat wave in Chicago. It was a 2-week heat wave, 1995, I believe it was. 750 people died here in Chicago, and thousands of people fell out with heat stroke. The first thing they give them intravenously on the way to the hospital to get heat stroke is saline solution, which is salt water, yeah. And it's absolutely criminal that these 750 people who died were all ones who were on a salt-restricted diet. They're all seniors who were on a salt-restricted diet. They died of heat stroke because these doctors didn't have the courtesy to call these people up in good manners, just to call up and say, look, whether you believe in the salt-restricted diet or not, right now you need to put a couple of tablespoons of salt in a gallon of water, be sipping on that until the heat wave goes away. But they didn't do that. And so all those people who died of heat stroke, who were under the care of doctors who were on a restricted salt diet, those doctors should be put in jail, okay, for almost like the same thing as vehicular homicide, the same type of thing as manslaughter, right, type of thing. Then here comes the big one. Right now, on the average, this is a Mayo Clinic study, came out in 2009. They said that as many as 30%, 30 people out of 100 in America now have celiac disease and have trouble absorbing nutrients. And as a result, there's people with 25 legitimately diagnosed diseases, which are all nutritional deficiency diseases. They're going to 18 different specialists for all this. And they're paying, tens of thousands of dollars a day to deal with this, and it's simply a gluten intolerance, and their intestines are damaged, they can't absorb nutrients. Well, when you can't digest wheat, barley, round, oat glutens, and you absorb these big chunks of what's called polypeptides, your body recognizes and sets up an intolerance to those partially digested proteins. You get gluten intolerance, you get celiac disease, irritable bowel syndrome, inflammatory bowel disease, diverticulitis, ulcerative colitis, Crohn's disease. The doctor's approach to these diseases are cut your intestines out. I can't understand how you have a malabsorption problem, they want to cut your intestines out. That's really dumb. But at any rate, because they have you on a salt-restricted diet, you cannot make stomach acid, so your pepsin won't work, and you cannot digest proteins, including the protein of wheat, barley, round, oats. Now, again, there's a big research project come out in 2009 that said, it used to be people got celiac disease when they were kids. And if you recognize it, you can save them from all these terrible diseases because you can get them off of gluten and they'd be fine. Well, now people who could eat gluten with impunity, they were really big on eating wheat, barley, round, oats, no problems. And suddenly now at age 50 or 60, they become gluten intolerant. Well, that's because over the years on a salt-restricted diet, they couldn't digest wheat, barley, round, oat glutens down to their simplest amino acids. Big chunks called polypeptides are being absorbed. They set up an intolerance to it. And now at age 50, 60, we have 80 out of 100 people with gluten intolerance because of this criminal advice to restrict salt.
So in terms of vitamins, supplements,
Yes.
People want to take vitamin C, vitamin D. You've mentioned a couple minerals like copper and selenium.
Yes.
How do we know which one we might need for, which one we might be
Well, you
deficient
need them
in?
all. You need them all, and here's why. And I don't like people cherry picking. When I ask them, I say, well, do you supplement? They say, well, yeah, I take vitamin C. Mm-hmm. Well, they're doomed to die 25 years early. They're going to have a whole briefcase full of terrible diseases and supplements, not supplements, but prescription drugs. Mm-hmm. And the reason is this. We need 90 essential nutrients, okay, 60 of which, 2/3 of which are minerals. Plants cannot manufacture minerals. Nutritional minerals, Scott, do not occur in a uniform blanket around the crust of the earth. They occur in a vein, if you will, kind of like chocolate and chocolate ripple ice cream. Okay? And so if you look at a field, the first row might have 18 minerals in it. 5 rows over, there might be 23. 5 rows over, there might be 3. 5 rows over, there might be 16. 5 rows over, there might be 0. Okay? Plants only need 3 to give the farmer the maximum yields in terms of tons and bushels per acre. Nobody pays a farmer for how many nutrients are in the food. Only tons and bushels, right? And so farmers don't care how many nutrients are in the field for the pasture, for the cows, or for the hay they get, or the grain, or what they sell for human consumption. They don't care. That's because they don't get paid for it. But what they do for their livestock is they give them a little supplement which has everything in it, which levels the playing field, so that the dog or the guinea pig or the rabbit or the monkey or the calf or the sheep or the pig or the chicken in Bangor, Maine, Miami, Florida, Atlanta, Georgia, Baton Rouge, Louisiana, or Denver, Colorado, Austin, Texas, San Diego, California, or Seattle, Washington, they all get perfect nutrition because they're all getting that little supplement that has everything in it. And whatever the animals get from their food is value added. Okay, so that's why we've been able to do all the things we've done in the animal industry. But humans, by contrast, they say, look, I'm eating well. I'm doing this whole organic thing. I'm doing this 4 food group stuff they got out now, but they've missed it. They had a chance. I was holding my breath, and I was hoping, praying that they would get it right. But when they made this new plate instead of the pyramid, they missed it, because right in the center of those 4 quarters where they divided that plate up, there's, let's see, in the upper left one there's supposed to be all this fruit, and the lower one the veggies, and the upper right quadrant is supposed to be the grains, whole grains, and then the right bottom is supposed to be the meats and proteins and stuff. They missed it. They missed it 1,000 million miles, Scott, because right in the center, 1989, my wife and I began to do the same thing. But right in the center, we put a little circle that has the 90 essential nutrients as supplements. Now, when you supplement that kind of basic premise they have now with the 90 essential nutrients, you'll have a perfect diet for everybody who eats. But now, in some places where they have the blue zones, they're called, where people live a long time, serendipitously, by accident, they happen to live into a place that has lots of minerals in the soil. If they eat locally grown food from a farmer's market, they'll live to be an average of 90. But 2 counties over, where those veins are pretty anemic, they don't have much in them from the veins of minerals, those same people eating the same diet, not the same food from the same locations, but the same diet. Well, I'm eating tomatoes and salads, and you know, my spouse died at 62 instead of 90. I eat the same way those guys do, so it must be genetic. No. Their tomatoes have 18 minerals in it, and your tomatoes only have 3. So unless you're supplementing to make up the difference, that's the problem. Because a tomato from Texas is not like a tomato from Florida, it's not like a tomato from the Imperial Valley of California or Denver, Colorado, or North Dakota. They're all different. And so you must, it's imperative that we level the playing field by supplementing. Supplements are the best insurance policy you can get, because it will help you prevent and reverse 900 diseases. An insurance policy with Blue Cross Blue Shield or Hartford only pay the doctors when you screw up. They do not add any years to your life. They pay the doctor when you screw up. In fact, the more you use the medical system, the quicker you die.
Doctor, what's your take on supplements and vitamins? You've talked about a couple.
Yes.
How do we know which ones we should take? There's so many different products out there.
You're exactly right. There's thousands of products out there. There's lots of claims and so on. And a lot of people feel overwhelmed. How do you wade through this stuff and find the ones? Well, when you look at our program, it's based on $500 billion worth of research. Okay? We've eliminated 900 different diseases in the livestock, laboratory animal, and pet animal industries with these formulas. We've tripled the lifespans of these animals with these formulas. Oh, I love it when people say, well, is there any research supporting what you're saying? Well, yeah, well, how about $500 billion worth of research? Government tax money, universities. And because I have a degree in agriculture and my major was in nutrition, animal husbandry and nutrition, where you learn how to formulate these things. Then I went on to veterinary school and actually got to use them in my patients. And then, again, did on one NIH project, the book of which is a 1,200-page book. It's in the Smithsonian Institute as a national treasure. Did over 17,500 autopsies in 454 species of zoo animals in a big project with Marlon Perkins from the old Mutual of Omaha Wild Kingdom days, and then 3,000 human beings for a comparison. 10 million chemistries, 10 million slides of special stains. So that's my background in nutrition, right? And then after that, worked for these big agencies like the Yerkes Primate Center, University of Tennessee, University of Missouri, Washington University, writing papers and doing scientific research and thousands more. Just as one project that my wife, Dr. Milan, and I did in China, 1,200 autopsies. I mean, who has that experience? Nobody has that experience. It's not that I'm smarter than anybody else, Scott. It's just I have more training than anybody else. And as a result, I see things that nobody else sees. And again, it's not that I'm smarter than them, but I am more highly trained than them. And so this is what makes our products different. We have all this background here. And so because I can read the language, I went back to school and became a naturopathic physician in 1978. And I chose naturopathic medicine because on the West Coast they're licensed as primary care physicians. I can do anything that an MD does in about 18 states. And we're licensed in, I think, 23 states now, but 18 were primary care physicians. The naturopathic physician there is kind of like a DO, but we can do anything that a medical doctor does, which really frustrates them, right? And through clinical practice for 33 years, employing these things with my patients of course have a lot of fun with this, because when you come into my office, my veterinary degree is alongside my medical degree, right? And the veterinary degree is like 4 times bigger in size. So the first thing they spot is that veterinary degree, and they say, oh my, am I in the right place? I'm looking for Dr. Wallach, the human doctor. I said, well, that's me. And so they started this little thing, and I don't even know who started it, but it got into the patient population. They say, well, if you're not happy with what your doctor's doing for you, go see Wallach. Now, he'll treat you like a dog, but you're going to get better.
So what's the best way, if we have one of these jobs or an athlete, to replenish this? There's millions of sports drinks out there.
There's a problem with that. Well, there's a problem with that. When you look at water, it has none of these nutrients. You look at iced tea, it has none of the nutrients. In fact, it's worse, because iced tea or tea or coffee has caffeine in it, which is a diuretic, makes you sweat and urinate more, right? Mm-hmm. And so you're going to lose stuff faster. Then there's the sports drinks, and can I name the names?
Sure.
Sure. Okay, Gatorade has 2 nutrients in it, neither of which is selenium or copper. Okay, so you're going to drink Gatorade, you're going to feel a little better because you're going to get some electrolytes, you're still going to die. And so we actually came out with our own sports drink, which is endorsed by a professional basketball player whom we started working with when he was 28. His career was over. Theo Ratliff was playing for the Atlanta Hawks at that time, plays for the L.A. Lakers now. And his career was over 10 years ago. He had bone-to-bone arthritis in both knees, just like Reggie Lewis at age 28. And the Hawks orthopedic surgeon said, look, his career is over. He'll be a lifetime project for an orthopedic surgical team, but he's not going to play basketball. So in 90 days, I rebuilt him, and he's made hundreds of millions of dollars in contracts since I've rebuilt him, since his career was over. His wife, Christina, loves me, right?
Sure.
And he wanted us to make him a sports drink, which has become a commercial product. It's called Rebound. It has 100 nutrients in it. Replaces everything you sweat out. So what's safer? Gatorade with 2 nutrients, none of which are necessary to prevent death. Well, I shouldn't say that. They will prevent death from heat stroke. Sodium and chloride, just salt water is what it is. Gatorade was made from leftover, outdated IV saline solution, the original Gatorade. That's what it came from. They couldn't inject it intravenously, so they drank it. So it replaced salt, sodium chloride, which is a good thing. You prevent heat stroke. But on the other hand, it doesn't have the other 88 essential nutrients. And so we've put them in this one drink called Rebound. It's the same price per serving. You get 100 nutrients and replace everything you're sweating out, prevent sudden death, or drink Gatorade and risk sudden death.
Doctor, if we can't always rely on food for good nutrition, we should supplement. Give me the top 5 if someone is to go out there and, purchase something. Because like you said, there's millions of things we can... Top 5 supplements or minerals that we absolutely need, or can you get them in a multi? Or?
I can't do that because you need them all. You can't cherry pick and take the top 5, okay? But if a person would say, okay, my economy is limited, okay, and I can't spend $3 a day. I can't believe that because, even people who are homeless and are pushing little carts with plastic bags hanging off it, they bring their carts into Starbucks and pay $8 for a cup of coffee, so I don't buy that. But let's say it's true. You got 5 people in your family, and you can't afford $3 a day for each person in the family with gasoline prices going on. Get our certified organic plant minerals with 77 minerals in it because they encompass 60 to 90 essential nutrients. Plants can, in fact, take carbon dioxide out of the urine, make some vitamins, and make some amino acids and some fatty acids. Okay, so a plant can do this. So if you're eating well, you might get some of that. But it's impossible to get the minerals. So if you had to pick one category, I would take our plant minerals. You're going to get 77 certified organic plant minerals. This is the 35th year we've been certified organic. You can go on our website and actually see the certificates showing that we've been certified organic for 35 years. These 77 plant minerals comes from an ancient compost pile, and they're up to 98% absorbable. That's all the FDA will let me say because there's bound to be somebody out there with celiac disease or something that can't absorb it, so I can't say 100%. But these are a liquid, which enhances the absorbability quotients and factors and percentages. They're liquid. The particle size is 10,000 times smaller than a red blood cell. And so that's why I got so excited about minerals, because that's what we give livestock. Okay? And so the plant minerals is the core of our approach to health.
Doctor, can you talk about colloidal minerals? What are those?
Okay, well, we were kind of marching in that direction.
Okay.
Thank you, Scott. Well, colloid is a suspension of minerals in a liquid medium. In our case, it's these plant minerals where we extract, as cold water extract these minerals, kind of like making sun tea, if you will. You put this compost in this big tank with an agitator in there, and over time, the specific gravity of that water goes up. You can actually see tea. You can put a big gallon of water and put a bunch of tea bags in this big glass jar, and you can see the tea pigment coming out of those tea bags and making sun tea. Well, this is how we extract these minerals, and they're in suspension. They are not in solution, where you get a positive and negative charge, like sodium chloride goes in solution. Well, in solution, you can only get 985 milligrams of whatever it is, whether it's sugar or salt or whatever, into solution in a quart of water, for instance, 985 milligrams. In our suspension, in our colloid, we get 19,000 milligrams, almost 20 times. Almost 20 times. So you're really getting a great bang for your buck here when you're buying colloidal minerals. And of course, the original audio cassette tape, now a CD, Dead Doctors Don't Lie, introduced the concept of colloidal minerals to the world. And that's what made it so popular. The fact that these colloidal minerals, people are so depleted of mineral, Scott. When you take an ounce of these colloidal minerals in a glass of water or juice, I mean, everything begins to work in your body, because these minerals are cofactors for little chemical reactions, enzyme reactions, biological reactions in every mitochondria, which are the little things inside your cells that manufacture energy and so on, manufacture proteins and enzymes themselves. And they're missing these things. People say to me, well, gosh, I took these colloidal minerals from you, Wallach, and I've never had so much energy. I'm only sleeping 4 hours a night now, and I wake up rested. Before I sleep in 10 hours, I wake up, I'm tired. I was thinking about going to a sleep clinic. Well, now I take your minerals, your colloidal minerals, and I just go. I don't have to take a nap in the afternoon. I sleep 4 hours a night, and I'm just energized. Why is that? Is it hyped up with caffeine? No. These are just these colloidal minerals. But suddenly now, at the subcellular level, at the mitochondrial level, you're getting the raw materials. You're getting the cofactors to make all these reactions work that have been sleeping, kind of like the Rip Van Winkle effect, right? It's like a car. Without a battery, you can have the best gasoline, you got the best engine, you got everything going, but there's no battery. And you're turning the key on, it's not even clicking because there's no battery. Well, what we do is put the battery back in people's bodies, and it just works like a charm to make things happen.